The Talus blood supply is unique because it is retrograde. There is the major blood supply comes from the posterior tibial artery, which gives a branch of artery to the tarsal canal, and another branch which is called the deltoid branch. Then another anterior blood supply is anterior tibial artery, which gives a branch called artery to the tarsal sinus. This also supplies the head and neck, and anastomose with peroneal arteries. And number 3 is perforating peroneal arteries. The tarsal canal is a medial opening of the sinus tarsi, and over here there is anastomosis between the artery of the tarsal canal and artery of the sinus tarsi. So in compendium, the anterior is supplied by anterior tibial artery and a peroneal artery, while the major of the posterior aspect blood supply comes from posterior tibial artery, which gives the deltoid artery and the artery to tarsal canal. Therefore, any fracture of the neck of talus are at risk for avascular necrosis.